Well, I was having a lot of pain with my hip for years, a lot of pain, and it was just getting worse and worse and worse. The pain was to the point where I could barely walk. Everything I did, because I still tried to stay active because I'm a caregiver, and I couldn't take the pain anymore. I was living on pain pills and becoming very immobile. I was using a cane. So I sent to the doctor and he told me I needed a hip replacement. And I went home and thought about it, and I didn't want a hip replacement. I didn't want to have surgery because of the recovery time. And I'm not sure how I found out about this clinic, but someone said, why don't you try some of these new things that are going on? And my daughter must have found out for me, told me I had to make an appointment and come here. And I did. And I was a little leery, thinking, well, what's going to happen? And he said he could no doubt help me a bit, and maybe it would be a lot better than it does right now. That was the main thing. That's all I wanted, no surgery. Dr. Brownlee explained the whole procedure to me, and we went through it. I thought about it, and I booked as soon as possible. I had the bone marrow transplant, extraction, and stem cell put in, and the same day, the pain was gone 90%. 90% of the pain in my hip was gone, and I had mobility, better than I'd had in 3 years. It worked for me to the point of eliminating pain, and I'm doing things, doing everything I used to do. And I am older, so I can't do things exactly like I used to, but I've got the range to go gardening. I rake leaves. I couldn't do that. When you have a very bad hip, you don't rake leaves. You can't. You just can't. I do everything. Wash windows, do all my housework, function, and if I get tired, I just sit down, take it easy for a little bit, and get right back on track. And I attribute it to whatever magic they did with the extraction and putting back in the stem cells. It was unbelievable. It worked for me to the point where I'm so grateful because I have mobility. I have so many things going on in my life that I need the mobility. I don't have time to recover from a hip surgery at the moment.